good. We're here to bring you this pamphlet, and we just wanted to talk to you a little bit about your Lovenox injection.
Okay, that sounds good.
So on this pamphlet, what it talks about first is what is Lovenox. So this is an injection that you're going to do every day. Since you just had surgery and you might be in the bed for a while, not being as active, we like to have our patients take these injections at home just to prevent a clot, or what we call a DVT. That's when you get a clot in your legs, and sometimes they can like move around and cause issues. So we just have our patients do this at home every day, just to prevent any issues like that.
Okay.
And upon taking this medication, it's super important to remember that this can cause bleeding. So we always want to tell our patients to make sure that they're looking for signs of bleeding, which could include blood in your urine, blood in your feces, severe headache that feels like a headache that you've never had before.
Okay.
And severe bruises, and then anemia, which could cause dizziness, weakness, and tiredness.
Okay.
And then if you have any of these problems or you're experiencing severe bleeding, we want you to call your provider right away. Same thing if you are having an allergic reaction, or if you have fallen and hurt yourself recently, or if you're experiencing swelling in your legs.
Okay.
Do you have any questions about that?
Nope.
Nope. Awesome. So we also like to instruct you on some things to avoid bleeding, since you will be taking this, what is technically a blood thinner. We just instruct you to use like a soft toothbrush when you're brushing to avoid any gum bleeding. If you use like a razor, maybe switching to an electric razor to avoid any nicks. Avoiding aspirin, and then letting your doctor know if you're on this medication so that they don't put you on any other blood thinners.
Okay, so next time I go to my primary care physician, I should tell them that I started Lovenox.
Exactly.
Okay,
Yep.
that sounds good.
And your physician has ordered you to take this one time daily in the morning, so we just ask that you take this injection around the same time, and you do it once a day.
Okay, sounds good.
So what we're gonna do now is we're gonna do what we call a teach back method. So me and Jaylee are gonna go through this, teach you how to do the injection, and then we're going to have you demonstrate the injection on yourself to let us know that you know how to do it.
Okay, sounds good.
That sound good? Okay, go ahead. Do you want to start?
Sure. So first, to administer this medication, you're going to start by washing your hands with warm soapy water, and then dry it thoroughly with a paper towel.
And then you're going to select where you're going to do it. So since this is a sub-Q injection, what that means is you're injecting it into like fatty tissue. So we say do it around your abdomen. Pick a spot on your like either side of your belly, around your belly button like line, but more towards the outer sides. And then make sure you rotate every day. You don't want to do it in the same spot. So pick one side, and then the next day do another side.
Okay.
And then once you pick your site, you're going to go ahead and clean that with an alcohol swab. Clean it for around 30 seconds and then let it dry completely.
Okay.
You don't want to blow on it, fan it, or anything. We want to keep it really sterile.
We also don't want to touch it after, because that is opening up that spot to more germs.
Okay. So then what you're going to do is, this is your Lovenox injection. So you'll get pre-filled syringes that you use once daily. So what you'll do is you'll remove the cap going straight up to avoid accidentally nicking yourself or getting any injury from the needle. So you'll take that lid off, and then you'll discard of that lid.
Okay.
And then after, you're going to go ahead and pinch with your non-dominant hand on that site where you've chosen. So you're going to pinch it, and then with your dominant hand, you're going to go ahead and take the syringe.
And then you're going to just insert it at a 90-degree angle. They say 90 to 45 degrees, which I know you're kind of like, what does that angle mean? So just insert it into that fatty tissue and making sure you're pinching. And then with your thumb of your dominant hand, you're going to press that plunger down all the way, making sure you get all of the medication in. And then you're going to remove it at the same angle. You don't want to like twist it around or move it or anything when you're coming out.
Okay.
And then once you remove it, you just want to make sure to not rub that area. I know it might feel a little bit tender, but we just want to make sure you do not rub it. And then
you'll just deploy the safety on the needle. There will be like a little sliding lid that goes over it. And then we're going to send you home with a sharps container that's a red box, so that you can put all the needles and anything like that into there. And then we'll also give you instructions of how to discard of that red box, just so you don't accidentally hurt yourself.
Okay, that sounds great.
Awesome. Do you have any questions?
I don't think so.
Perfect. So what we're going to do now is we're going to do a teach back method. So we'll walk you through those steps, and we'll have you do that.
Okay, sounds good. I
So-
think I'll do it on my stomach first.
Perfect. So for the sake of this video, our patient would get up and wash her hands. And next, you're going to pick an area where you want to do your injection.
Okay, we'll do it on this side.
Awesome.
Okay, honey, you don't need to be scared.
I know, I'm kind of nervous. I'm scared of needles sometimes.
Well, we'll be here to walk you through, and if you have any questions or anything, just let us know, okay?
So as the parent, can I do this injection for her?
We like to have the patient do it just so that they are confident in doing it on their own, but you're always there to provide moral support, and if anything were to happen, you can be there to call the doctor or anything.
Okay.
And then should she take it at the same time every day?
Yes, take it at the same time every morning, just as your doctor prescribed.
Okay.
Okay, so we're gonna go ahead and get started. You already washed your hands. Now we're going to pick the site and clip the site.
And I did it. I didn't even think about it. You literally did something. That's what happened. Right. You're not selfish. Right. You can do it all.
Great.
We'll let that dry completely.
We say wait about 30 seconds just so that all the alcohol can absorb and get everything really clean. Okay. So now that it's been 30 seconds, we're going to have you take this and remove the lid, hold at a straight angle, yep, and pull off, and you would discard of that. And then make sure you're holding it in your dominant hand.
And with your non-dominant hand, you're gonna wanna pinch that skin, making sure you're only pinching the fatty tissue.
Like that?
Yes.
Yes.
And then go ahead and insert at a 90-degree angle and push down with your finger.
Now pushing all the medication in slowly. Perfect. Coming out at the same angle, and now you'll deploy that safety on there. Awesome. And now we can discard of this in the red sharps container. And we'll also be sending you home with one of those.
Okay, awesome.
You did a really good job about making sure to go in at the same angle. You wouldn't rub or anything. You should just let it dry. And yeah, anything that you have?
I think that's it. Do you have any questions for us or any concerns?
I don't think so.
Perfect. Well, we'll be getting you all of your injections and your supplies, and just call us if you have any questions.
Okay, thank you so much.
Thank you, and we'll leave this with you.
Thanks, Mom.
Summarize the strategies used to address health literacy factors of your patient population.
So for our flyer, we decided to use big words and easy to understand language. So you could tell that the words in here are words that the common people will know. Since Lovenox is usually for people who just recently had a surgery and usually are bedridden, they're also possible that they are also of older age, which is very common. The purpose of our flyer is to prevent more blood clots in the legs. So since they just had a procedure, they're often not moving around, and it can also prevent angina, and MIs. We said that it's important to have pictures and large font so it can be very inclusive to all people who are trying to administer low Lovenox injections, and it is very inclusive to people who quite don't understand the medical terminology in the 4th grade level.
Identify possible changes you might make if you had a different patient population, such as a different culture, age, or with a disability.
So for someone with a reading disability, for example, or a low reading level, we would definitely make the words and the amount of teaching on here more minimal. We would make sure that there's more pictures involved, that the patient can really just look at the pictures and be a visual learner as we are going through the injections steps. As you can see, we use pictures along with words so that both literacies can also both understand our teaching. Someone with a visual impairment or a hearing impairment, we would possibly do, for visual, we would maybe do a podcast or kind of a voice recording explaining step by step in detail about how we would do the injection and the side effects and all of that. And someone with a hearing disability, we would maybe make a video doing a step-by-step like we did in our most recent video for the teaching video. For different cultures, we would kind of cultivate that to the patient itself. So we would do research upon administering and teaching the patient about their culture, or teaching the patient about the Lovenox injection. For example, Muslim women, we would need to change the handout and writings in regarding to the patient speaking to the doctor, due to the belief that a Muslim woman's husband must speak to the doctor on their behalf. It's important for us to realize and be inclusive and culturally competent as a nurse to ensure that we are making the best decisions for our patient that can help the patient care. For any individuals who do not speak English or English is not their first language, we would have we would have a translator translate this into their language to ensure they can also read, they can also read the pamphlet, and they can also get the full information without making any confusion, and that they are confident in their injections. Overall, we're trying to make the culturally competent and inclusive care for all cultures, ages, and anyone with a disability.